Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Dr. Stephen Reiser here today all the way here from South Carolina. Now, Dr. Reiser is a fellow ChiroTrust member. I'm a ChiroTrust member and have been for last 8 years with Ben Altadonna, and you've been a ChiroTrust member too for how long?
Probably about the same amount of time.
About the same amount of time?
Yeah.
So, just to let you know, we only refer out of this office to fellow ChiroTrust chiropractors.
Yeah, excellent.
Because they're taking the pledge to just adjust and not do all these frill
That's right.
roller tables and diathermies and hot packs and all that crap.
Right, exactly.
So tell me a little bit about your practice while we're here.
All right, well, so it's Carolina Chiropractic, and we're in Boiling Springs, South Carolina. That's what we call the upstate of South Carolina. If you're in the area and you're looking for a chiropractor, come look me up.
That's for sure. ChiroTrust doctors adjust the spine and the vertebral subluxation complex and practice mainstream chiropractic, correct?
That's exactly what we do.
Yep. All right, so this is Dr. Reiser's first visit here. I have not done his examination yet, and with his permission, I'll go ahead and do the exam for you. Is that okay?
Sure.
Okay, so the first thing I'll have you do is just walk on your tiptoes towards Renee. Good, now your heels. Yep, good, okay. Now put your feet together, close your eyes. You're a little weavy, but not too bad. You don't have a positive Romberg though. Okay, you can relax. So we're gonna check his posture now. I'm gonna have you close your eyes, Dr. Reiser, and flex your head forward and backwards for me, please, sir. And then back to neutral. It's a real honor being able to treat my fellow colleagues from around the country. Okay. Now, he brought his x-rays with him, which I already looked at previously. He does have a curvature in the spine. We call that a scoliosis. So I'm going to have you sit right here and face that wall first. We'll finish your exam. This is a foramina compression test. Does that cause any pain anywhere?
No.
Okay, so we're going to go backwards and to the right and down.
Yeah, a little bit right there.
Okay. And how about back and left and down?
Yeah, a little bit the same.
Same side or left side?
Left side too.
Okay, if you tilt your right ear to your right shoulder, does this tighten up?
No.
How about this side? A little more on this one.
A little bit, yeah.
If I lift your skull straight up like that, does that make your spine feel better, same, or worse?
Yeah, that's better.
Okay, look straight ahead. I'm gonna push down, resist. Good, same thing here, resist. Good. Mm-hmm. So his reflexes are +2 equal and active upper and lower at this point. I'm just going to check his biceps and triceps. I'm going to pull out, resist. Now I'm going to push in, resist. Excellent. Pull out first. In. Good. Okay. I'm going to have you stand up right here one more time. This is called an Adams test. Go ahead and bend over like you're going to touch your toes. Tell me if and when you have pain.
Okay.
Go ahead and stay bent over like that for just a moment. This is a positive Adams test. You can see that the right side of his spine up here has greatly impacted the size on the right side compared to the left side. So he has a convexity over to the right here, but down in the lumbar spine you can see it's higher on the left side. So this is a positive Adams test. Okay, relax. Does it hurt coming back up at all?
No.
This is the test that you usually see nurses doing on children in schools to determine whether they have scoliosis or not. And his was positive. Was it positive when you were a kid?
Yeah, I think so.
Yeah?
Yeah.
Okay, let's lay you on your tummy here.
Yeah.
That's probably how you first found out about it, huh? Legs are even. That's a good start. That tightens up just a bit in the low back and thighs. Not bad. So you do have a little SI subluxation right there. L5's not bad. Mostly tender up in here. Is this where you get most of your pain when you do have that scoliosis pain? Or is it more up here?
More up there. Yeah.
Okay.
So,
Yeah, this whole right side's really. You have a rotatory scoliosis. I'm sure you already knew that. He's got trigger points in both his traps. The left one's a little bit tighter, and that's out right there on C6, C7, and C3, 4 on the left. C2 is also left. Okay, lock your right leg straight. Lift your entire right leg up off the table. Okay, relax that one. Do the same over here. Good. Did either one of those feel more difficult to lift you?
about the same.
Okay, so I've already done a detailed history on him. He doesn't have a whole lot going on. I told him he's going to be my easiest patient all year, and then when I found out he was a chiropractor, it's really going to be easy. So I'm going to adjust both of his SI joints, lumbar spine, thoracic spine, rib cage, and his cervical spine due to vertebral subluxation complexes. That's all we do here is we treat the vertebral subluxation complex. We do not treat any disease or pathology. These might be a little sore at first, Dr. Reiser, because they've been out a while. Well, your thoracics are pretty locked up because of that scoliosis.
Yeah, they're very locked up.
This actually should feel a little easier. Okay, you're gonna feel your head popping up a little bit on this next one. Good. Okay, let's turn you on your back now, please, sir. I'm adjusting his cervical spine P to A because his x-ray showed he had a loss of the normal cervical lordosis. Good. Okay, slide down this way a little bit and put both arms out now. That's it. Okay. You can relax your hands on your tummy there. There you go. Should have felt that from your knee all the way up into your lumbar spine.
Yes.
Same thing here. Let this go. Yes, sir. Good. Okay, let's set you up. Face out that window now, please, sir.
Yeah, that's a little.
That's a little tender, huh? There we go. Is your glenohumeral joint. You have a labrum tear?
I honestly don't know. But I
It
think
felt
it's-
a little skip jumpy in there, so it felt like more labrum.
I think that's an adjusting thing.
Yeah, it probably is. Chiropractors have the worst. I have the worst lower thoracic problem.
Yeah.
That's where I get it from bending over this table adjusting all day. There we go. Okay, let's come over here on this knee chest table. Get some paper down here for you. Alright, there we go. Have you done this before?
Not since I was a student.
Yep. Kind of let your spine just sink down in there now, Dr. Reiser. Good. Get a tissue pull. Okay, go up. That's all she's going.
Yeah. Bit tight, okay.
Yep. I'm gonna fix that on this one though. Okay, butt right here, head up this way. Slide up just a little bit, a little bit more underneath there. Okay. Yeah, if you just push away from there, make sure that's on top of your pelvic iliac crest. Good. So as you saw in the examination, he had good patellar reflexes. I kind of check him on this table just because it's easy to do, and I'm a martial artist and give him a little karate chop. There you go. Okay, lay your head back. Now, I want you just to breathe through your nose, keep your teeth together with your left ear. There you go. Wasn't so bad, was it? How far down did you feel that?
About 5S1.
Really good. That's where you should feel it. She's still kicking too. Let me have your neck. Boy. Crack Egg's definitely gonna love you. So if you're up in upstate South Carolina, make sure you look up Dr. Reiser's practice and go visit him. Alright, we'll stand right here in front of the mirror. Okay, I'm gonna have you close your eyes again and flex your head forward and backwards, please, Dr. Reiser. And then back to neutral. Boy, look in the mirror right now. You squared off like a military man. Bend over again. Now see, he's still got this positive Adams test in here. That's probably not going to go away with the adjusting I'm going to do on him this week. Go ahead and relax. Did that hurt at all though?
Yeah.
Great. So there's another chiropractor that's up in South Carolina that people see on YouTube that you've had patients come to you about and talk to you about different things that they've done, but
Yes.
we won't mention any names on that.
That's right.
But how did you feel like your first initial history and exam and adjustment was today here at Advanced Chiropractic Relief, and especially coming from a chiropractor?
Extremely thorough. You went over everything. Nothing was missed adjusting. That was a new experience for me. Your manual spinal decompression. It felt great. Definitely recommend come down to Houston and experience it for yourself.
And you're gonna be here all week, right?
No, I'm actually going to be here till tomorrow.
Oh, okay.
I'm going back to my practice.
You got to buy your practice,
Yeah,
yep, no
that's
doubt.
right. Yeah.
Well, thank you for visiting with
Yeah,
us, and
absolutely.
thank you for sharing your video on YouTube.
Yes.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. And don't leave yet, because I still got to shoot Dr. Rogers. All right, let's try that one thing again, forward and backwards and neutral. So just like the rest of us, you're bent forward a lot, and you got a lot of cervical reversal going on when you do that. So this is how I combat that. Bring it straight back in the Z-axis, then look at the wall behind you. I'm going to adjust your atlas on the X-axis. There, okay. Try that again, see if this feels any smoother to you than the previous one.
Yeah.
Looking right down the middle. Good job.
Very good.
All right, so that's it. We'll see you next time.